Again, welcome to all of you from me as well. Hopefully tonight we can go over some information that you guys will find useful or can kind of take home to utilize with your own children at home with potty training. As Danny said, I am a pediatrician out at the Eagle Run office. I've been there for 8 years now. I also have 3 of my own children, 2 and can everyone hear me if I move back over here? Still hear me? Okay. An 8-year-old daughter and a 6-year-old son who are successfully potty trained, and a 2-year-old who is currently in the getting started phase. So I am right there with you all right now at home as well. So tonight, what we will try to discuss, if I can get this to work. So we'll go over just a little bit about the history in terms of statistics. When does the average child become potty trained? When do they have dry days, dry nights, stool control, etc. How do you know when they're ready to get started? So assessing when that child is ready and when you are ready to tackle this task. What to do when problems do, getting started, what to do when problems do occur. We'll talk briefly about nighttime, which is different than being dry during the day. And then lastly, like Danny said, we'll leave some questions at the end. Mastering potty training, is one of the first challenges that you may have. That is something where both you and the child, the dynamics will play a role in it. Not only do you need to look for their readiness, but you'll find out how do they react to change, how do you react to frustrations, how do they react to frustrations. So this is a pretty monumental accomplishment for both child and parent. You also, the child will learn how to react to external pressures. And hopefully at the end, then this child will also be able to have one of the very first things of where they actually are very proud of themselves, where they can have some building self-esteem if you go about this in the right way, hopefully. I'm going too fast. Again, it can also be, many of those things can be very fun activities. However, this can also cause some stress and some pressure. Particularly on the parental side. There's quite a bit of pressure for us to conform to these societal expectations. I'm sure, if any of you have children in daycare, or if you have friends who have kids of similar age, you'll hear all about stories of, oh, well, my child was trained by 18 months, or, oh, I didn't have to do anything and my child was potty trained. Or maybe at their school or preschool, they need to be potty trained in order for them to start that program. So that can be quite a bit of pressure. If you have a child who is in that age, 2 to 3, when we're typically talking about this, they really want that independence, and sometimes that independence can be a frustration for parents as well. Again, it can lead to power struggles. Unfortunately, sometimes even negative things can come out of potty training, such as accidents, the inability to hold a urine or enuresis, the encopresis, where a child gets fearful or they have pain associated with going to the bathroom, so they can start holding their stool and become constipated. And in extreme cases, if all of this pressure and accidents and societal expectations build up, there is a risk for actually child abuse in some of these scenarios. There are different approaches in terms of child potty training. I know there have been some approaches out there that will talk about potty training a child who is even under age 1, where it's really more of the parent looking for the cues, the parent taking the child to the toilet to have their urine or bowel, and having their bowel movements. But what we're going to be talking about tonight really is more of the child-centered approach, which is based more upon the child having the ability to take control of their potty training or their toileting, where they have the physiological maturation where they're able to get themselves to the toilet, undress, do their business, and also have the behavioral maturation. So that is what we will be talking about today. The child-oriented approach, is associated with good results if you do start this at the right time. If you wait until the child does show the signs of being ready, there is a very high success rate, high rate of continence. Can be pretty rapid if, again, you kind of pick the right time when the child is interested and engaged and has the physical maturation, and hopefully then won't have that regression that you'll see sometimes if you start too early. Just some, basic statistics. Again, in the U.S., I found multiple reports, but one report did show that there's the daytime continence. About a quarter of children by 24 months a huge jump between 24 and 30 months, where almost 85% can have some daytime control of their urine, and then by 3, a large majority of kids are able to have that continence during the day. Now that's not the same as nighttime. Nighttime accidents or nighttime wetting is a little different than that daytime. One report, you can find certain cultures that are actually significantly sooner than we are in the U.S., or even by 18 months you may have higher rates. But just for a comparison, the Swiss children actually are a little bit later than the United States. So their bigger jump is really between 3 to 4, where they see the large percentage of children becoming continent. So again, average age approximately 30 months with large individual and cultural variation. The AAP does report 40%. I'm guessing that that's including nighttime continence, because that doesn't really jive with the other statistics. And again, range typically 18 months up to 3 to 4 years. It's a generalized statement to say that your bladder control typically comes before bowel control, and again, dry days typically before dry nights. It is also true over large populations that girls tend to be a little earlier than boys, but again, there's obviously individual variations there. First child also tends to take a little bit longer, which may be that parents are excited, anxious, and they just start maybe before that child really is showing some signs of being ready. Sorry guys, I can't get the timing of this. All right. So again, bedwetting normal up until age 4 to 5, and even up until age 6. In fact, from a pediatric standpoint, we wouldn't talk about any type of an intervention or saying that it's abnormal until at least age 6. And if you do start too early or significantly before age 2, there is a higher incidence of chronic bowel retention or constipation, the stool holding and the soiling. And one study did show that toilet training less than 27 months of age is correlated with a longer duration of time from starting the training until being successful. So again, that key factor that we're going to talk about over and over and over is just assessing to make sure that the child does have those physical and motivational readiness for the training. So again, looking at things, is my child ready? So we want to make sure that there are some physical characteristics, intellectual characteristics, and then of course motivational characteristics. First off, just bladder control is different with different individuals. First the child needs to actually have the awareness of that, or that sensation of the bladder filling up. They also have to have the ability of your brain to actually override the reflex contractions of the bladder. Little ones, again, will have very small volumes of urine throughout the day. So until they have some of that maturity, you're going to have a very, very difficult time having any continence. They also need to be able to know that feeling of tightening the external sphincter, where it's holding the urine inside of the bladder. And just to put things into perspective, a typical 3-year-old bladder can hold about 5 ounces of liquid. So again, not a huge volume. So other things to look for, is my child ready? Are they able to walk or run steadily? Or are they able to communicate to you, that they can get to the toilet in time? Are you noticing that you're having a drier diaper for longer periods of time? Are we waking up from a nap perhaps dry? Or are we noticing that we're dry, after that morning diaper change for a few hours? Do they have the ability to get themselves dressed? Can they get their pants up and down? Are they able to help with dressing and undressing? Are they having well-formed stool at regular times? And this really, I think, is an important factor that I'll talk about again as the talk goes on. But if we have any constipation issues, really, really take care of those before you start potty training, because potty training can be a huge pitfall. A huge pitfall is if you have a constipated child. And just are they mature enough to be able to hold on for a minute? So are they able to listen, follow directions, and actually hold and wait for a minute? So the intellectual readiness, are they able to actually sit in one position? Can they sit on the toilet for the few minutes that it takes to relax and let things come out and read a book or talk to you about being there on the toilet? Are they actually showing interest in what goes on in the bathroom? Do they notice that, oh yeah, every time, I notice that you go in there every once in a while, or big brother or big sister goes in there? Are they showing signs that they're having a bowel movement? And are they able to actually follow some simple instructions? If they start to understand a place, they understand, well, okay, that the potty goes, or my pee or my pee, whatever you want to call it, goes in the potty, or my poop goes in the potty. Do they have, speaking of pee or poop or whatever words you want to use for it, are they able to communicate those things? Are they able to get your attention or have a word or communicate what's going on? And are they understanding those physical signs? Are they padding to their diaper maybe when they're going to the bathroom? Or are they able to communicate to you, prior to having a bowel movement, that they can tell that those physical signs are there? Motivational readiness, and this may be a tough one too. For a lot of these toddlers that are 2 or 18 months to 2.5, that we're talking about during this kind of readiness assessment period. Do they have the motivation to not wear a diaper? I mean, a diaper can be kind of a cool thing when you're a little child. I don't have to stop what I'm doing. I don't have to stop playing. I can just do my business wherever I am. And so if they really don't have the motivation, that's going to be a big pitfall as well. So do they have that desire to be independent, the me do it, I do it? Are they in that phase where they really want to be in charge of themselves, be in charge of their actions? Do they also take pride in their accomplishments? Are they starting to show that they might be proud of themselves for accomplishing something, like snapping something together, putting something on their plate? Are they starting to show some of those signs? And are they in a cooperative stage? And that's also another big question. The no phase, that every single thing you ask them to do is no, 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 no phase. Probably not an ideal time to start this process. It may, in certain cases, take a month or several months to get from starting to finishing and to being completely dry. So if they're in a very negative phase, it may not be the time to start. Not just the child's readiness, but we need to make sure that you are ready. Are you in a time of your life or a time with your schedule where you're ready to tackle this as well? I know it says summertime is easier, but that really is just saying that, or do you not have as much going on? Is your schedule not hectic? Are you not having other things going on? Is there something stressful coming up? A new move, a new job, a new baby, a vacation, whatever it may be, because you really need to take the time to focus on this. And it does take a while for this to develop. So, along those lines then, so, consider delaying, if you do have a second sibling coming along, or if you are moving, or if someone's going back to work or again starting a new job, too many changes, in a child's life could certainly increase the risk of failure. So when at least one caregiver can devote the time and emotional energy necessary to be consistent, then you might want to even look at this as at least 3 months. It may be faster. It may only take you a week or 2 weeks or 4 weeks, but in some cases, from start to finish, this may take several months. You also need to have reasonable expectations. Accidents are inevitable. They will happen. And despite what you may think, they are not doing it to spite you. They're learning. They're trying to figure this process out. So having the intellectual readiness yourself, kind of knowing that I'm going to have to be positive, I'm going to have to be changing poopy underpants, I'm going to have wet pants, I may have a wet couch, and just knowing that this is going to be part of that process. And that kind of goes along with that last statement. Just knowing that that your child is learning. Be patient. Give them some time. Try not to take it personally that they are really upsetting you on purpose. All right. So how do I start? You've assessed their readiness. You've got some time. You're excited. You're ready to do this. You think they're ready. So now just start that preparation. And this may start before the actual truly potty training stage starts. So this could start maybe when you're thinking, okay, I think we're getting close to being ready. I'm getting close to being having some time to devote to this. My child seems to be starting to show some of the signs. So start talking about it. The show and tell. So get some of the books out or rent them from the library that kind of talk about going on the potty. Make it a fun thing. Use examples. So if you have an older sibling, or if they're in a daycare setting, or if you're willing, have an open door policy where they can come in and kind of see what goes on in the bathroom and just go through the potty talk. You may feel kind of silly, but if you actually say, oh, I felt like I had to go potty, so I went into the bathroom. I sat down. I went to the bathroom. I wiped. I washed my hair. I flushed the toilet. I washed my hands. Talk through it, because they may see you do this all of the time, but not really understand all of the steps that are going on. Change the diapers like a robot, and that essentially means don't make diaper changes super fun, because if diaper changes are really fun, if they get tickled and we laugh and we play, well, I don't want to stop that. That's a fun part of my day. Make the pottying the fun part. Make sitting on the potty, going in the toilet, going into the bathroom, that's the fun part. Certainly change their diaper, but start to maybe make the diaper change part not so fun. You can practice sitting on the potty even before you feel like they're truly ready. Get a potty chair out, get a little insert for the toilet, let them sit on it. Even if they're sitting on it in their clothing or with their diaper on, just kind of practice, what does it feel like to sit on the potty? So the right stuff. So now, what all do we really need, though, to make this a comfortable process? A potty chair really is nice, just something that's comfortable for the child. Imagine yourself having to dangle up on top of a seat where your feet aren't touching. You feel like you might fall in. You're not quite sure what's going to happen when that toilet flushes. So, make it comfortable. Their fears may seem irrational to you, but they are very real to that child. So getting either an insert or a very stable lid for the toilet with a step stool or a potty chair on the floor, makes them much more comfortable. Have it easily accessible. Have one, wherever they are playing, or have them out where you are. Have it where they can see it, and so they know where it is if they need it. Make sure that they do have easy to remove clothing. If they have buttons that you have a hard time getting off, how do you expect that your 2-year-old to unbutton the clothing? So get some nice elastic band pants or skirts for girls, or something that's nice and easy for them to get up and down. Certainly you can grab the underwear, get the pull-ups ready. In terms of the pull-ups, the only true advantage probably of the pull-up is that it does go up and down. I know a lot of them will say that they'll feel the wetness, they won't, it might help with potty training. In my experience, and I think in most parents that I've spoken with, their experience, there really isn't much difference. It feels like a diaper to them. It looks like a diaper. The one advantage is it goes up and down. So if you want to invest in the more expensive pull-ups, great. If you don't, no worries there. You could certainly, though, get some underwear or some training pants so they're more absorbent for those accidents, though, and have them available as well. If they think it's fun, get some of those special wipes or soap that they feel like is just theirs to wipe if they have a success. You could have some type of reward, stickers, charts, go to the dollar store and get tiny little trinkets that they may like, or a stamp for their hand if they have a success. Targets, little boys, if they want a target, get Cheerios or other little targets that are flushable that you can stick in the toilet that they can aim for. It's, make it into a game. What 2-year-old boy doesn't like a game? So something that you could, make it a little bit more fun. If you are on the go a lot, if you are around places, a travel seat or something that you're able to take with you might make life easier if you are a family that can't take the time to just be at home a lot of the time during this cycle or during this training. So again, get the right clothing. Don't get anything too difficult, and like I kind of talked earlier, prepare by example in terms of talking through it when you go to the bathroom. All right, so we have the supplies. We have the child that's ready. You're ready. Get started. Jump in. See how they do. Check. Before you commit to the whole shebang, just test the water. See if they're ready. If you do, even if you only have a few hours to spend with them, take their diaper off. Maybe let them be naked for a little while. This says 2 hours, but I'd say if you just have a little short period of time, every 15, 20 minutes even, go sit, go try. See if you can't get a success, so they can start to get that association of, oh, this is what you're talking about. This is what you want me to do. If you're going for bowel movements in particular, the best time would be about 20 minutes after a meal. That's really when the gut kind of moves, your gastrocolic reflex. So that would be a good time to start if you're trying to get a bowel movement success. Really get excited. Stay excited. Did I mention being excited? If you make this out to be a really fun activity. If you think this is a great fun time, that hopefully your child will also, catch that contagiousness and will also feel, okay, yeah, this is something that's fun. If they have a success during this starting phase, make a huge deal out of it. Again, you could do a sticker, give them a little sticker to put on a sticker chart, stamp their hand, make a big sign that says, I went potty in the potty, show it to mom or dad when they come home, Skype it to grandma, whatever the case may be, make it a big deal. So once you try this out, once you're giving it a little bit of practice, and they are starting to show some success, they're going, they're getting it, they're motivated, it's fun, then start that transition to the training pants or the cotton underwear. So make sure you're having at least a week of some success, of some times where you're able to say, all right, you did it, way to go. If you do rush out of diapers, again, you're going to probably set yourself up for frustration because they will have accidents. You will be changing a lot of pants. You will have a wet couch or a wet floor. And again, we don't make sure we're not trying to motivate by any punishment. Really, we're trying to motivate by success, by rewarding. So don't force them to wear soiled diapers for extended periods. That's not going to work. It's not going to be negative reinforcement. It's just going to get them used to sitting in a soiled diaper for longer. If you do try the success, if you try to transition and you're having all those accidents like I talked about, take a break. Go back to diapers for a little bit, maybe wait a little while, try it again. I am fine with some, again, kind of a positive reward. You don't have to make it a huge reward. You don't have to go out and buy a huge, expensive toy or present. Just try to do the praise. If you can just make a huge deal, do the sticker chart, do the star chart. I know everyone's probably heard of the one M&M or the one, Skittle. That's okay for some kids if it works, but something that's instant, concrete, that they can get just as a positive reinforcement for a successful attempt or a success. So again, some tips after this, try to adopt a positive, loving approach. Keep them in loose clothing. Try not to battle about it. One pitfall to avoid is to try not to scare the child, so avoid flushing while they're on the toilet if possible. That, again, can be kind of a frightening experience for someone who's maybe a little timid about the whole process. One recommendation that I heard about that, if you're out and about, even if you already have a child then who's using the toilet at other places, if you have the sensor, put a Post-it note over it or put something over the sensor or something so that the sensor doesn't go off unexpectedly so that you don't have a child become fearful that way. Avoid over reminders. If it becomes a battle, or if it does become more of a power struggle, with an over reminder, that may backfire on you as well. Typically with boys, we would recommend to have them start sitting first, and part of this is because they may not at first be able to distinguish between urinating and having a bowel movement. They strain, so they may end up having an accident, and that again may frighten them or kind of set you back. So at first, sit them down, you'll have them practice. Once they're doing better with that urinary continence, then you could maybe switch to standing and sitting, letting, if a boy who's willing to model that whole process, or again, sticking the targets in there for them to shoot for or aim for. But typically sitting would be best at first. All right, and I've talked a little bit about it, but really making sure that your child is not getting constipated is a huge, huge issue. I would say a large majority of the kids that I see in my office or who I've talked with who have had issues with potty training are stemming around constipation. And really it can be easily set up. The child gets a little constipated, they're trying to figure out how to go, they're trying to figure out how to hold their urine, hold their stool, they hold it maybe a little too long, then they have a painful hard bowel movement, it hurts, they think, well, I'm never doing that again. They hold it some more, and it can become a really vicious cycle. So really try to stay on top of constipation. So if you have to really push the fluids, maybe even reduce some of the more constipating foods during this time frame, such as dairy products, bananas, things that might be a little bit more binding. Make sure they're drinking plenty of liquid during this time. That way you can catch some urine, as well as hopefully keeping those stools soft. Again, another kind of tip to avoid a pitfall would be use the training pants as part of that transition to underwear, not as the first step. And when we're talking about all of this, don't worry again at first about the nighttime or nap time. There are a few children who will, from the get-go, be completely dry at night, who will be able to be really dry during nap time. That's not the case for everyone by any means. So be excited, get excited, do this all when they're awake. Put the diaper or the pull-up back on during nap time. Put the diaper or pull-up back on at night. You can deal with that later once we have the daytime success. But at the same time, you don't want the child to just wake up, think, oh yeah, I have my diaper on, I'll just go in my diaper. As soon as they get up, try to get that off, try to get them to the toilet, so they get into that habit of when I wake up, I go to the bathroom. So again, a little bit more about the stool training. If you are lucky enough to have a very regular child, it may be easy. When you see those signs, they're grunting, they're making noise, get them to the toilet. Some kids will have some fears where they think, well, wait, something is falling out of me. Is that really supposed to be falling out? They may have that thought that my poop is a part of me. If you do notice that you're having some of that fear, one thing you could try is actually when they have a stool, in their diaper, go to the toilet, put it into the toilet, let them flush it, talk about it. That's where the poopy wants to go. The poopy wants to go in the potty. Let them see that that's okay and that's where it is meant to be. There are some books too at the end in the reference section that you can look at that talk specifically about some of that really frightening aspect of the stool that some people will have. All right, so a little bit about night training. You have some successes during the day. You're getting close. You're getting there. I still would put that pull up on them overnight. But if you feel like, okay, we're doing great, we're having success all day long, my child seems to really be getting the hang of it, you could try a few things. Limit fluids after dinner to just their bladder capacity. So, again, we said it was about 5 ounces, so let's try not to do any more than that. Make sure that they do empty their bladder before they go to bed. Make sure that they are starting, with a clean slate before bed. If they're waking up consistently with a dry pull-up or a dry diaper then in the morning, then after a week or two, you could potentially try without it, talk it up. Say, okay, tonight we're going to try underpants. Put a pad in the bed, obviously. You don't want to have to be completely soaked through, in the morning. If they practice, getting up and going, let them know. If you feel like you need to go potty in the middle of the night, it's okay to get up and go. So show me, what would you do? Lay down. It's middle of the night. You have to go potty. What do you do? Have them practice. Get up. I go to the bathroom. Just so they know what to do in the middle of the night. Make sure you have a night light or something in the bathroom so they don't feel fearful of getting up and going too. Don't get too discouraged though. Again, bedwetting, maybe not even nightly, but occasionally is completely normal up until again age 4 or 5. It does tend to run in families. So if my brother or my sister or I, wet the bed, it is higher incidence or higher likelihood that one of your children will too. We do tend to see that as a familial pattern. And we think it's more just with the maturity, with their ability to wake up in the middle of the night, bladder capacity, etc. There are some non-medication interventions out there for the bedwetter if they are approaching 6. The bedwetting alarms are one. I'm not going to talk about those, I guess, in detail today, but that is something that you could certainly talk to your pediatrician or your healthcare provider about should you get to that 8 point and we're still having problems with nightly wetting. So common pitfalls. Starting too early. You have that pressure of preschool coming up or pressure of your friend talking on Facebook about their child who's potty trained at 15 months. So really starting too early I think is one of the biggest pitfalls. I have had a few children who do show those signs of readiness before that 24 to 27 months, but that certainly is not the majority by any means. The other pitfall, not preparing, not knowing what you're getting into, not talking it up to the child, not having all of those, the potty chair, having all of your equipment at home, putting too much pressure on yourself, putting too much pressure on your child, getting frustrated, and again, thinking that this is that you have a very distinct timeline. Now, bribes are a little different. We talked a little bit about a reward. And I think, the difference between a bribe or a reward or a reinforcement, if you think about it, something that motivates you, it's something that you know that you're going to get if you succeed, if you know you want to do it. A bribe would be more kind of holding the carrot right in front of them, like, all right, here it is. So try not to be too, not to bribe them too much, not to say, okay, well, if you do this, then we can go to Disney World, or if you do this, then we can, do whatever the case may be. So make sure it's more of just a concrete reward, reinforcement right away, nothing that is too far-fetched. And again, punishing for accidents really is not going to get you very far. Now, certainly you could have your child take part in cleaning up. You could have them take part in going to get the wipes to clean, or have them do that. But that's really more just taking responsibility of the action, not like a harsh punishment such as taking away privileges. So again, what to expect. You will have wet pants, you will have messes, you will have tears, perhaps from you and your child. You will have setbacks. All very normal and definitely happen a lot with potty training. Try your hardest to stay calm. Try your hardest to stay positive. Just like a lot of times in parenting and in childhood, it may feel like when you're in the middle of it, this is never going to be over, it's never going to be done. But you maybe made it through those first few weeks of a baby who didn't sleep, or a child who was sick, or whatever the case may be, and it will not last forever. You will have a potty trained child, I promise. Try to give your child some responsibility. Try to give them the choice. So if maybe we had some successes, we tried, and then we had a few setbacks, tell them, okay, we practiced going on the potty, you went on the potty, you're going back in diapers. When you're ready to go back to poop and pee in the potty, then you can get your Spider-Man underpants back, or then you can get this back. So just give them the choice. Just say, it's up to you. You tell me when you're ready. Sometimes that works, sometimes it doesn't, but again, letting them know that that it's their choice. And again, you may need just a cooling off period with no potty talk, with just going back and giving it some time, and when they start to show some more signs, going back at it. Rarely there will be some kids who truly have toilet refusal, who they have control and they either then just refuse to go, or they do have the bowel movements in their pants, and then just will flat out refuse to use the toilet. 20% may have this problem at some point. Again, there are many things that may lead to this. Some would be trying at a too early age, maybe trying right before a big life change, trying before a sibling comes, or we change daycares, or a split up with parents, whatever the case may be. It may happen if you and the child are just really having a conflict, during this time. Or it could be from one of those irrational fears. The toilet flushed on them one day and that scared them. Or they were out and about and they had an accident and Aunt Sally got mad. Whatever the case may be. I do go, over this and over and over and over again, but those constipation, that really can lead to a lot of those problems. If that is the case, I would tell you to stop, work on the constipation, work on that, if you have to, with your healthcare provider, and then go back to the potty training. If you do have a child with a difficult temperament, it may spill into the potty training phase too. So you may be having issues with other behavioral problems that may spill into the potty training as well. And again, trying to give them control again, giving them giving them the choice, saying, okay, when you are ready, we will go back to this, but you would want to set some sort of a motivation, in them as well. So again, working towards some diapers that they really like, or working towards not having to stop what they're doing, go get the wipes, go get the diaper, go do this, go wipe them in the sink, whatever the case may be. So the not that we're again punishing, but we're having something somewhat more negative with the accident. Try not to punish, try not to nag. Again, backing off for a while. If you have an older cousin or sibling who is willing to help with the encouragement, that can be a great incentive and a great motivation. There are lots of books and videos and things out there that will even talk about some of those fears or some of those accidents. All right. We talked a little bit about this, but again, you could make the diaper changing, like a robot, or having them really help you out. So it's not that, well, I just want to keep playing outside with my friends, so I'm not going to stop what I'm doing. So I don't want to go to the bathroom. If that's the case with one of those children too, put the potty chair outside. If they're outside playing with a friend, put the potty chair outside and make it easier for them to get to. Attempt that positive feedback as best as you can. There are, again, some of those kids that we've tried all of these things, you don't really know what it is that's wrong, we're not constipated, we've had successes, they should be able to do it, but they're still having difficulty. Then if we reach age 4 and we're still having those difficulties, that would be when I would say go ahead and talk with your healthcare provider about even seeing a mental health specialist to institute a personalized program for your child. I did talk to a few of my families who did have difficulty with their children, between 3 and 4, kind of what would you have wanted to know, what would you have done differently? And the overwhelming comment was, I wouldn't have started so early. I would have waited until they were ready, that they felt that they did probably push them when they weren't ready, and that's kind of what led to the setback, whether it would have been constipation, holding, or just power struggle. So the ABCs, so again, assess your child's readiness. Make sure that your child is ready, make sure that you're ready. Buy the right equipment, create the routine, push them full of the fluids, set them on the toilet, make a big deal out of it. Demonstrate, again, how to use the potty with your child. Consider delaying until 27 months, or we're showing those signs of readiness. Explain the process, foster the habit, grab some training pants. Handle those setbacks gracefully, they will happen. Then after success, introduce the night training and jump for joy, you're done. I think I do have then a list of just some resources at the end, some of which have some specific areas that they cover. Again, like the poop issues, the free the poop are on the next page, it hurts when I poop. And those all are specifically good for any fearful child that is having problems with their stooling. But I went through that faster than I thought I would, so you got plenty of time to answer questions. So does anyone have any specific questions for me? Yes?
I had my son, and he was ready, and he was using the potty and everything else, and nothing to my knowledge happened, and then he just reverted right back to diapers.
How long ago? So essentially, for those of you who aren't on site, so okay, so a woman had...
And we live out in the country, so of course, he would get to potty outside like Daddy, and so, and then he was fun, and so, but I never stopped doing that. But then, to actually get him to go poop in the potty, he did get to poop outside. When we got the puppy, it was a whole poop like the puppy thing. And then he was starting to poop in the potty, and he was so excited, and he'd have to, want to call my sisters and tell them all, and, we would reward him, and then one day he just had a fit. He would not go in the bathroom.
So she's essentially having trouble with her child reverting, pretty significantly from going in the toilet to not at all, and without any known trigger. So nothing that you know of. Are we not urinating either? We're not peeing either.
Right now.
So now
he did a couple times last week because I had promised a package of diapers and Lightning McQueen underwear, and then he puts the Lightning McQueen underwear on, but like you said, I took them away and said because he peed in them, and then I said when you're ready to wear these, you can have them back. Well, he's having a fit about he wants the underwear, but he doesn't want to go potty.
Sure. Well, I would stick to your guns. That you need to show me, that you can stay dry and that you can go in the potty before you get the Lightning McQueen underwear back. In terms of the poop, there is one other incentive that I've talked to some families about when they're having a hard time, and that is going out and buying like a poop toy. I don't know if you've heard of this before or not, but they can go buy a poop toy with you. They get to pick it out. They know that it's for when they poop in the potty, they get it. Put it up where it's visible, but they can't reach it. So up on the refrigerator, up on the shelf, it comes, if he poops in the potty, it comes down for 10-15 minutes, it goes back up on the shelf. So he poops the next time, it comes down for a little bit, it goes back up on the shelf. So it's not something that I pooped once, I get it, so then I don't really have a motivation to ever poop again. I mean, it's I get it only after I poop. Now maybe you might have like this chart where, okay, once you do this 20 times or whatever you choose, you get to keep it for good, but by then it may, hopefully we're doing better. But the key with that, again, is it's not you get it once and then you're done. It only comes down after he poops. And you may need to, you could even instill, both of those things. You've got the Lightning McQueen diapers out, visible, or Lightning McQueen underpants out, visible, but not, accessible to him. You've got your poop toy out and visible, but not accessible to him. And then back off. Don't really say anything. If he walks by, I want that. Well, okay, yeah, when you're ready to go poop in the potty. I want my Lightning McQueen diapers. Okay, when you're ready to go, when you're ready to be dry. So it's there. He knows it's there. And when he decides, all right, I'm ready to do it, you can do it. But backing off on the reminders and the, being on top of them is potentially something to try.
Yeah, I didn't give up. So, okay.
I have a 20-month-old little girl, and she's obsessed with the potty. But she sees mommy go in there, and she has to do everything mommy's doing, and she'll go and she'll sit on it, and she wants to wipe and flush the toilet, and she's not afraid at all. But I've heard that I shouldn't let her wipe or wash her hands because she's not going potty. She's only peed once, and actually it happened. My husband kind of caught her. She said potty, and he picked her up and took her in there, and she actually did it. And that's only happened once. I mean, typically she'll say potty and she won't go, but we just are like, okay, no potty, all done. But I've heard you shouldn't let her wash her hands because she's not doing anything.
Well, I mean, and at that age, I would say that you are still kind of, you're just trying to get her ready for it. And if you can have a few more successes where she does go, where you sit and she says potty and she does go potty for you, then I would say then you could go through the whole motions, let her wash her hands, let her do that whole bit. I don't know that I would be too hung up on not letting her wash her hands, though. I mean, if she is actually sitting and trying, then I think it's legitimate to let her, go through the motions of, I wipe and I wash my hands. I don't want her to get raw, if she's doing it too much. But again, I would say that, you're probably still at the phase where we're practicing, trying to get a success. She's interested and she wants to try it. So if you can get a few successes where she actually is getting what you're really telling her with going potty, then you could really start it up. But if she's just sitting and thinking, okay, well, I'm going potty, again, maybe not quite there yet for the, truly moving forward with
like 30 seconds,
Yeah.
and then and I don't force her,
Right. Yeah.
because she's the one that started doing it. She just said potty one day, and she went in there and she'll put the lid
Sure.
down, she'll flush,
Yeah.
she goes over, and my husband's like, she's a genius. I'm like, no.
No, and so again, so essentially, for those of you who can't hear, so she has a 20-month-old who's very interested in the potty, but not necessarily going. Wants to go in there and play on it and flush it and wash her hands, and has gone one time successfully, like on the toilet. But does she let her, do that? And I would say, again, to a certain extent, I would, just so if you can catch her, and then when you do catch her, then make a huge deal out of it. Not just to get to wipe your hands, or wash your hands. You could say, well, okay, yeah, you tried, good job, we can wash your hands. But if she actually does go, then, do backflips. Like make it a huge deal. Not just the okay, good job, you tried, let's wash your hands. Right. Yeah. Yeah. Exactly. Yeah. Yeah. Yeah.
We actually have twin boys, and any suggestions as far as handling twins?
Sure. So the question is about twins. And really with twins, I think you can look at them as individuals. You don't have to look at them together. If one is showing signs sooner than the other, start with the first one. There's no need that they have to do it together. So, with twins, if I don't know what their dynamic is like or how they relate to one another, but look at them as as two individuals, not as a team that you have to do them at the same time. So if one's ready first, start with the first one. That's not a problem at all.
We have a 16-month-old, kind of the same thing. He's so interested going potty, and so the reason he goes is because of toilet paper, so he could wet himself up, or flashing the toilet. He sits there and he just takes the toilet paper out. And usually it happens after he actually pees, like in his diaper. He runs and he goes like, potty, potty, let's go, just change me, like that. So, but my question is, what would be the better way for me to teach him, hey, you get a potty here, not in the diaper?
If you could, if you have a soaking wet diaper, just like with a stool, you could even like squeeze the potty, into the toilet. Nope, the potty needs to go in the toilet, just to try to get that whole concept. Or if you maybe want to let him have a little naked time for a while, just so he when it actually comes, then you say, okay, go into the potty. So he actually sees the act of the potty or his pee going in the toilet versus, okay, I went in my diaper, now I want all the reward, now I want to go flush and play with the toilet paper. So actually trying to show the urine going into the toilet. It's like before bath time, maybe if you notice that he's had a dry diaper for a little while, then go sit and try, and try to sit, if he's truly ready, you want them to be able to sit there for a little bit of time, because it may take a little while for them to actually sit, relax, be comfortable, let the potty come out. If you want to do the whole trick, like, let the sink run a little bit, read a book, take your time. I mean, just to try to have a success, versus just really being excited just about playing with the toilet. Because that is a little different, being excited about playing with the toilet than really being able to know I need to put my pee in the potty.
I'm having really good success in the house with letting him run around naked, and I put loose pants on him. I haven't bought the underwear. We're only in our second week, and I think I'm going to stick with not buying underwear because I heard it confined to him, and I think my little guy would still think it's a diaper. My question is like, I don't know how to pack to leave outside the house. I only got brave one time, and we went to the grocery store. It was the Husker football game, and we got to our friend's house, and I just knew he was going to potty, and he did potty in his pants because he was just... I don't know when to put the diaper back on.
Sure, I mean, if you're having good success, so essentially she's having good success at home naked, but you can't really run around naked all day long, especially if you do need to leave the house sometimes. So it's okay to put, like the training pants on, maybe a more absorbent training pant on, that's looser so he doesn't feel necessarily the same as the diaper. And don't get, and he maybe needs to have an accident to understand, like, oh, okay, even when I'm in the car, or even when I'm out, I still need to go potty in the potty. So it's okay, for them to have an accident some of the time. So try not to get too discouraged by that. So when it happens, oops, that's okay. You went in your pants this time. Next time, tell me, I can take you to the potty here. Or if you want to, even when you get someplace, say, okay, here's the potty. If you need to go, tell me, we can go potty here too. So, or if they're with other, care providers or other people, have them maybe help you out too. Because if they can have a success with someone else, then they may know, oh, it's okay to do it, not just at home, when I'm home with mom and naked.
Even just take them.
It's okay. Yeah. I mean, now again, if you feel like, okay, I've done this, and every single time he gets wet, it's also okay to put the diaper back on if you need to, just temporarily, again, and you could just, start it right back up again, when you get a chance. And if you start to notice, hey, you know what, I put a diaper on him, we went to the grocery store, he came back dry, okay, maybe it's time to start putting the pants back on it, or the underpants on him. Yeah. Yep.
We live in Lincoln, so we drive back and forth between Lincoln and Omaha a lot. And some of the times it's too long of a trip for them, for our children, younger children. What do you...
Sure, I mean, and that again may be a sign that they don't have the bladder capacity yet. I mean, so if you can make sure that we empty our bladder before the trip, and that's something else that I guess I didn't talk about today, but it's okay to do reminders like once they're having successes. Okay, we're leaving now. Let's go potty, or it's time to go potty. So make sure that even if they say I don't have to, empty the bladder before you go on the trip, or start as best as you can with an empty bladder. But if they consistently, empty their bladder before they go, and they're still having an accident, for an hour drive, again, they may not truly have the capacity, or they may not be, ready, because you would want your child to be able to be dry for at least that 2 to 3 hours, to really say, okay, they're ready to go, they're ready to do this, and I have the bladder control and capacity to start. I don't know if that answers your question, but yeah.
Our son was born at 25 weeks. He's 2 now. He knows what potty is. When he goes potty, we put him in underwear. He knows when he goes in his underwear. Do you have any suggestions for like teaching him to tell us when he has to go potty? He knows when he goes. He just
So does he? So essentially saying they have a 2-year-old who is aware when he goes, but isn't communicating that to you. Okay. Yeah, sure. Yeah. And so this is a good point. So a child who does have a little bit of a language or speech delay. So if he's not able to do any sort of a communication, such as like signing to you, or gesturing or doing something, so that he has to go. Again, it's maybe not the time to do it yet. It's wait until he is ready. Wait until he has the capability to do it. So you're not setting him up for failure. You're not setting him up to start, and then he has accents, and then he feels bad, and then so it really wait until he's ready. Yeah.
On it and
Sure.
I made
Yeah.
a whole big deal about it.
Perfect. Yeah. No. Perfect. And
Try
that's
to get it
yeah.
and get it
Yeah.
in.
No. And again, introducing it though, letting them try, letting them practice, making a big deal out of it is great. But taking that next step to truly like having that expectation and truly putting them in underpants again, you may not really truly be there yet. I don't know who was next.
Well, kind of in addition to that, how do you just get them to they can't be bothered to stop to go potty? Like if you take them there, they're fine.
Sure.
But they just don't want to stop what they're doing to get there. They can't, and they won't initiate going.
Sure. So essentially, the question is, someone who just doesn't want to stop, or doesn't want to be bothered. They're playing, they're having fun, whatever they're doing, they just don't really care. So that kind of goes to that motivational readiness. One thing you could try is move the potty chair to where they are. So it's right there, so they don't have to move very far to go to the potty. And again, saying, okay, here, and instead of when you're first starting, instead of asking the question, okay, do you want to go potty? Okay, it's time to sit on the potty. And have him, have he or she sit, and then hopefully then if you can get a success, if they can actually go, and again, you make a huge deal out of it, then hopefully some of that motivation will be there then to actually have that praise and have the attention and have that pride again. But you may initially, until they're showing any of that motivation, make it easy for them. But if you try that and they still don't doing it, again, they may not be ready yet. I mean, I know people. I think we all have this timeline that we need to have this done by their time they're 30 months. She's told me 30 months. That's when they should be potty trained. That means that's average. That means some are 24 months. That means some are 36 months. Some are 38 months. I mean, so again, if they're not ready, don't take it personally. They will be.
So kind of tying in with that, it was kind of both questions. If the child, you can tell that the child is pushing to go potty and doesn't want to be interrupted. So, but if you say, okay, it's time to go potty, it's okay to just go have them sit on the potty.
I mean, it is, but if you see a huge pushback, like if they're kicking, they're screaming, they're mad, they're upset, then I'd say no. I'd say they're not ready. I'd say leave it alone. Now maybe another time, when you're not in the moment, you're not, that's not right there. You could start, reading the books or talking about it, or letting them see, someone else, appear. Again, if you have someone available, do that and make a big deal out of that, so they at least have some motivation to try. But again, if you make it a battle, if they're fighting you, if they're mad, they're kicking, they're screaming, probably not the best time.
Excuse me. My son is almost 3 years old, and he's really good at letting you know that he has to go pee-pee. Our biggest problem is the number 2. He's regular. He poops every day. My problem is, I've tried the suggestion with there's a toy on his dresser. Yep. You can get it if you poop on the pod. Mm-hmm. He's done it twice, and he's had this toy for 6 months. I'm good at, okay, you can play with it, and then it goes back up there. Mm-hmm. What are some other suggestions? Because this is really frustrating.
Sure. So she has a son who's good with the urine, but not at all good with the stool. She's tried the out of reach poop toy, and he is regular. So we're not. You don't think there's no pain, there's no constipation, there's really nothing else at all going on. No. Okay. When you do change, as soon as you know that he is soiled, do you change him right away?
I'll ask him. I know he's pooped. I'll ask him, has he pooped? He's like, no, doo-doo. I'm like, yes.
Okay. Yeah. No, I mean, I guess I would still then, even if he doesn't choose then to go in the potty, right away, as soon as he's pooped, okay, we're stopping playing, we're stopping what we're doing, we're going to change, you go get the diaper, you go get the wipes, you help me do this, you go throw it away, just so it's at least still stops him from what he's doing. He can't just continue to play, with the poop. And again, you could put the poop in the toilet, have him flush it, just go through through the motion, of all that. And you could, again, talk about, if you think he would be interested, get one of the poop books. I mean, there are a lot of them out there, like that the poop wants to go on the potty. Just talks about, my poopy, really, that's where the poopy wants to go. And try not to get frustrated, and I don't know how old he is, either, but try not to get too frustrated. Usually, if there isn't the constipation, if they don't have like leaking of stool because of they're so backed up or they're not having significant pain, it will happen.
Tell me some of the reasons why a child would still wet the bed at 6 or 7 years old.
Well, I mean, there's lots of different thoughts. I mean, some, just very deep sleepers that just their reticular activating system is just not mature enough to actually wake up to know that they have to go to the bathroom. Some thought is that they make more urine still. Like we all make antidiuretic hormone overnight that causes us to make less urine, and that can that your antidiuretic hormone may not be there until, with most people, kids, it's there between 3 and 5, but some maybe not until 12. I mean, so there are lots of reasons potentially, and we do see that tend to run in families, which makes us think that there is some genetic or some physiological reason for that. But it's different with different kids. Some kids, again, it may be constipation. Some kids, it may be a low bladder capacity. Some kids, there's lots of different potential reasons.
My daughter is pretty much potty trained, and I know she has the bladder capacity because she's dry overnight, and she did really good for about a month prompting to go potty. She's pretty good with her poops, but a couple weeks ago she just stopped telling me she had to go potty, so I started like having her go every hour, and so she'll hold it now till I take her to go, like, or before we go outside we go. How do I get back to her being in charge of deciding when it's time to take a potty break?
So just so I understand the question. So she does fine overnight. She's dry overnight. If you take her every hour, she'll go. But if you don't remind her, then she'll have an accident.
I don't know if she's holding it because she's waiting for me to tell her it's time to go. But she'll then just go until she has an accident. She won't come to tell me that she has to go, and she also won't come to tell me that she's had an accident. She'll just kind of So to kind of help her get back in the swing, we've been taking her at regular intervals. So now we need to get back to, okay, it's your thing. You got to tell me.
Sure, yeah. Yeah, and it sounds like she definitely does have the control. She can hold it usually until you tell her, and she can hold it overnight. But I actually think that you may have answered your question, that I think you do need to just put it back in her hands. I think you just need to say, maybe before you're going to leave, if you're going to be on a long ride or you know that it's going to be inconvenient for a while, go ahead and remind her then. But if you're just at home, I would say, you maybe do need to just let her take responsibility and let her tell you. Now, when she has the accident, though, then you're going to hopefully can catch it as quickly as you can, have her help you change her, and then maybe instill again some sort of an incentive for going on her own, whether that again be like a sticker chart working towards something, and if the sticker itself isn't a motivator, you could have a picture of, okay, if you can go without mommy reminding you 5 times, then you get to stay up and watch an extra show with mommy, or we get to go to the park, or we get to do whatever it may be, but working towards something that would be a motivation for her. But I agree, I think you probably need to back off. Oh, lots of questions. Yes.
Sorry, I'm a third twin.
Sure, yeah.
Anyway, they both, like, when they're naked, either outside or inside, they'll potty, but they can start and stop. If we say, but I'm just trying. Is there a good way to, without scaring them, if I want them to stop long enough for me to get them to the potty? Because the first time I did it, I was like, stop.
Oh,
sure. My brain was like, oh, hey, you're bored.
Yeah, that's it. So don't beat yourself up either. That's fine.
And you go for it, and you're like, we're not gonna make it.
Yeah.
So is there, is there a way I can try to get them to hold it without scaring them, or something I have to?
Well, I mean, so essentially, so that the twins who will do well, if they're doing the whole naked play time, they will start to go. They used to be able to start and stop, but one time accidentally, dad frightened him by saying, "Oh, stop!" But maybe just if they like to play outside, if like that's something that if they're commonly around. Again, I just would say make the potty chair accessible so it's not so far away. So even like while he's going, you can just steer him over there. I mean, just so and then again, if you even get some of the urine in the toilet, make a big deal out of it, or put the potty chair where they're playing, put it where they are, so you hopefully can catch him. And again, pay attention. Make getting in the toilet a bigger deal or a success. But
my son is 40 months and still does not want to potty train. And he's done it a few times and got super excited when he got to hear it when he pooped and everything. And it's almost like now it's gotten to the point of like, haha, I just pooped. I just peed in my diaper. And it's like we don't know what to do at this point. I mean, we've tried treats, we've tried presents. We don't know what else to do.
So she has a child a little over 3, who still like really no motivation. It sounds like essentially, to go. I mean, have you ever, and this is again a little different than something like the 24 month old. Have you ever tried just to I mean, does he help you change the diaper? Does he help you do all of that? Yeah. Okay, so he'll go in the diaper, doesn't care what, and he'll change it himself. Yeah, you could.
He knows he's doing it.
Yeah.
And he'll even go hide. Like he'll go. We can sometimes figure out when he's gonna poop, but sometimes we just don't catch it quick enough. Like all of a sudden he's quiet and not near us. It's like, what are you doing? And he'll go, I'm playing, and he'll totally lie to us, and he knows he's going to the bathroom.
Okay. Is he? I mean, does he? I mean, is he like defiant in other ways, or is he? Yeah. Okay. I mean, it could be just finding whatever it is that is his motivator, and then backing off. I mean, so and you could even try to put him in like the more like a training pant or underpants, so it's maybe a little bit more uncomfortable, and again having him involved with that, and then finding whatever the case may be. But if he he is defiant with, like you said, just a lot of other things. Yeah. And I mean, are you having to work with those things too, or is he doing okay with other day-to-day activities?
He's usually okay with that. It just, you can sometimes he'll just butt heads with, he's very stubborn. But it's sort of, that's just part of what it is. It's like he wants just on his terms.
Yeah. And and if that is the case, I mean, you may then need to say, okay, well, we're just gonna, we'll maybe put you in like a training pant, or put you in this at least during the day, time, or if you're, and then again have him be a part of the whole process of changing, finding whatever it may be that is a motivator for him, whether if it's getting out of maybe the not so attractive training pants to the fancy underpants, or whatever the case may be, and then truly backing off. Like if he has an accident, don't even talk to him. Like just change him, go through the motions, but don't even talk about it. Like have him help you, no emotion one way or the other. If you want to get frustrated and go scream in the closet, fine, but but don't let him necessarily see your frustration with him having the accident. And if he ever happens to have a positive, then say, way to go, you should be so proud of yourself, you did it all on your own, just to make it his deal and not your deal. But
like he's at daycare.
Yeah.
But just I mean, poop there, but he doesn't.
Yeah. I mean, it does, it very well could be that, he again just doesn't have that motivational readiness and is being, a little bit defiant in that. But, but if that does continue with really putting it on his terms, letting him decide, but making going a little bit, uncomfortable, or at least disturbing, to his daily routine. But again, it will happen. Yes.
We have a 23-month-old, and
23 months, 23 years, yeah.
And he goes to daycare full time, daytime, and there's a little girl that started, and she's a couple months younger than him. And just a couple days ago, since her mom has her going, they at the daycare had her start going, and they also chose to start with our son. And we haven't introduced it to him. He goes with us, he sees us. He shows very little sign. We're not
trying to start it anytime soon. Sure. But they took him, he got scared, and so they said he started crying after like a week. You know? Okay. So what do we do to like get his fears away from that to where it was before?
Sure. So the question here is a 23-month-old who is, in a daycare setting. Another child has started potty training, so the daycare just went ahead and started him, even though he wasn't really showing any interest, and mom and dad weren't really ready to start, and now he is showing some fears. So I would really just talk to the daycare and say, we really aren't seeing any sign that he's ready. He's now quite fearful about it. I think it would be best, if we just backed off and and not talk, let him go back for a little while, and then maybe in another month or two when he isn't showing having the fears anymore, if he starts to actually talk about it more, if he's seeing that other girl at daycare going, and then he maybe starts to show interest, then starting again. But I think you're right. I think just backing off and not even mentioning it or talking about it or putting any pressure at all on him right now. And then if he starts to show some of those signs like we talked about, if he's starting to talk, tell you that he has to go, asking about the potty, then I'd say go ahead and start up again. But hopefully they'll understand and can back off for a while. Yeah.
Going with the daycare question, I'm a single parent, and my mom read online that when you're doing a potty training thing, it all has to kind of go together as one. It has to be either you're going to do the timer every hour or whatever. Is that true?
If you're in that kind of like getting ready or preparing phase, not necessarily. If you're just kind of trying it out, seeing, getting them exposed, talking about it, see if you get a success, I'd say it's okay, to try for a little while. If you've started to have success and you really want to try to get to like the underpants, then it would be very nice to be consistent between what they're doing at daycare and what you're doing, at home. And really, daycares can be often very helpful because they do have, they can put it into their routine. The other kids are going. They can have kind of peer models to see how the whole thing, works. So it can be a benefit if you utilize it that way. So you can kind of ask and see, okay, well, what signs are you seeing that are telling me that my child is ready because I'm not seeing those signs, or or if you think you are seeing the signs, say, I think I'm ready to start. If you guys could help me out, that would be great. So trying to be on the same page when you're really ready to get going, though, I think is a good idea. So if you're saying to like, no, I'm just not ready. I can't do it right now. I've got too much else going on, and I don't think that my child is begging to wear big pants and go in the potty, then I'd say, then they can maybe expose them, do a little bit, but don't push it.
I have a 4-year-old that wakes up every night, 1 to 2 times a night, to go to the bathroom, and she wakes me up every time. I have to encourage them to get up and do it on their own. And also, my other question is, like, when do I start cutting back liquid? Because it's every night, midnight and then 3 o'clock, midnight and then 3 o'clock, and I think it's starting to interrupt.
Okay, and that's been the case always. So essentially, she has a 4-year-old who gets up twice in the middle of the night to go to the bathroom. So always has been midnight and 3 o'clock. So this isn't like a new increase, like we.
Sometimes it's midnight, sometimes it's 1, but it's usually 1 to 2 times.
Okay, and you said it's a she, is that right?
Yeah.
And then has she ever been dry? Has she ever gone longer? Has she ever gone through the night?
When she was really little, after she first started potty training, she would go a couple of nights without going at all, and then it was just consistently 1 to 2 times. She'd come in and say, I've got to go to the bathroom, or she'd be sitting on the toilet yelling, Mom, come wipe me.
Okay. And during the day, like, no urgency, frequency, like she has to go out, like she can hold it fine during the day. She has what you would consider a pretty normal bladder capacity during the day. No problems at all with that. Okay. Because I guess I'd first, if there's, this is something else too, if there's ever an acute change, like we are doing, all of a sudden we're having accidents, or you're doing fine at night, and all of a sudden you're getting up. I mean, you don't want to totally discount a possible medical issue going on, like a bladder infection, or, increased urinary protection or something, else going on. But it sounds like this is something that's been ongoing and not like an acute medical issue. I would say, does she drink a lot before bed?
During the day, she drinks a lot, and then at night she always asks for water, and then if we say no water, then she'll cry and beg, just a little bit of water, and so we've started giving her just like a little itty small cup.
Okay. Yeah, I mean, if you're really giving her, less than like that, like 5 ounces, if you're only giving her a few ounces and you are emptying the bladder before bed, and we're still doing that. I guess my other thing to consider, if does she go a big amount? Like, is she voiding a lot, like at those times? Like, it's a big volume? Okay. I mean, if you haven't, I mean, I guess I would want to make sure that she doesn't have something going on, that she isn't making too much urine, that there isn't anything else like a UTI or anything that's causing her to be excessively thirsty or have excessive urination. So that would be one thing, I guess, to rule out before you completely say this is more just behavioral or bladder capacity. I would look at the stooling pattern too, though, because there is definitely a lot of thought that that in a tiny little pelvis, like a 4-year-old would have, that if you have a big stool mass in there, there's only so much room for the bladder to expand, only so much room for bladder capacity. So if she's constipated at all, or she's not emptying, her bowels at all, that's going to impact, how much she can hold overnight, and maybe have her get up and go more often. But really, then other than making sure there's no other medical issue, do the night light. You could have. So she feels safe. You could again do the practice. Okay, we're going to practice. If you have to get up and go potty tonight, what are you going to do? Show me. How are you going to do it? And then if you could even reward a night where she doesn't wake you up. So again, you could have the sleep fairy come and visit her if she stays. She doesn't wake you up all night long, or you could get a sticker in the morning if she doesn't wake you up. All night long. But I would make sure there's nothing medical going on too before you force that issue too. Yeah, just to make sure. Yeah. Anything else? We're losing people, which we are over time. But if there aren't any other questions, thank you all for coming. I hope something tonight was worthwhile for you, and good luck with the potty training adventure.